Computer, yes. Good morning.
Good morning.
So
Morning. How are you guys?
We're great, Grant. How are you?
Good.
Good. It's Guest Wednesday. Of course, we're having technological problems because that is the nature of our lives with poor Dr. Grant Syverson, who has been so patient, not just this morning, but for the previous fail from a couple of weeks ago, where we had to just mime our entire conversation because I could not figure out how to make sound happen. So Grant, thanks for your patience. Thanks for rescheduling. Thanks for ratcheting up anxiety up and down. So we appreciate it. And because I like to double duty, thanks for sitting in front of such a great piece of Andrew Stark art.
Yeah, if you could sit like that.
Yeah, I'll just be like, I'll speak off camera. That'll be more comfortable for me anyway. So
yeah, so thank you so much for being here, Grant. We're excited to have you.
Thank you. I'm happy to be here.
So can I tell the story? I guess I should have asked you this before we went on camera, but can I tell the story of how I discovered how I know you twice?
Yes, of course.
Okay, so Grant and his fabulous wife, Melissa, joined a program that the Arts Partnership runs called Community Supported Art, I think 3 seasons ago. So these programs run May, July, and September. So we just wrapped this season up. But when we could gather, we gather in locations and there's incredible food and great performances and incredible art and really lovely wine tastings from Bernie's. So I often will walk around with a bottle of wine and, fill people's glasses as I'm connecting with them. And I didn't know Grant and Melissa at all until they joined this program. So probably 2 seasons ago, we were at Rustic Oaks, which is this incredible venue south of Moorhead. And I have a bottle of wine in my hand and I say to you, can I get you some more wine? And you say to me, no, I'm good, thanks. And I say, okay. And then you said to me, I know your husband. And I said, you do? How do you know him? And you said, from Saturday mornings. And I said, what does that mean? And you said, from Saturday morning.
Yeah.
And it dawned on me that the only thing Maz does on Saturday mornings besides watch soccer is go to AA. So I'm holding this bottle of wine out like this. And I think I went, oh, because then I felt immediately terribly guilty that I'd been, sort of shoving wine on you. And you were so gracious about it. And it was such a lovely way to share with me this thing. And also so perfectly you, Grant. Because you are so unassuming about your alcoholism, but you also don't, or your addiction, but you also don't hide it. So when you found out that we were doing these and you said, I'd love to come on and be a guest, it was in perfect keeping with what we have gotten to know about you, which is to just, you don't walk around and say, hi, I'm Grant, I'm an alcoholic, right. But you also don't shy away from it. So I love that story because it really endeared you to me. And it was just, again, it was so gracious of you to not say to me, look, I'm an alcoholic. Could you move that wine out of my face? So I appreciated that.
Yeah. I had recognized Maz from the meeting. I mean, it's a big meeting on Saturday morning. Usually there's like 100+ guys there. And, he's the only one with an accent. Generally.
And the only one who doesn't wear
over the pond accent.
Yeah.
And also a great name, is you don't remember people named Maz. So
that is true.
I knew another guy named Maz when I was in residency, but his first name was Middle Eastern. So I can't remember his actual full name.
Yeah.
But I was just, happy to see someone I knew that, was also in recovery. I think we've talked about this before. I think one of my biggest fears when I first got sober was just how to exist in a world where people still drank and I couldn't. And so it took me, and I rationalized that in my mind for a long time, even when I was drinking, like, I can't do that. It's just people will think I'm too weird and everyone will notice. And, you just realize that for the vast majority of people who aren't alcoholics, they are not paying attention to what people drink all the time. And so, I don't really have to talk about that much at all, to be honest. If I go to an event or even out for dinner with colleagues. Some of my colleagues don't know I'm an alcoholic, and I would tell them if it came up. I'm not like ashamed of it, but certainly it just is not something people bring up. And I don't know if it's because, again, we live in the Midwest and people are polite, or most people just don't care.
Well,
And
I think the truest thing you said is that nobody's thinking about you as much as you're thinking about you, because they're thinking about themselves.
yeah,
We all are. That's not the privilege of the addict. That's just true of all of us. It's why I always use this example. If you are part of a picture, a selfie, everybody says this: "Oh, it's a terrible picture," because they're only looking at themselves. It might be great of everybody else, but they haven't bothered to look. Yeah.
Yeah, and it took me a long time to understand that, it's just the paranoia that I had about, and my anxiety that I had, that, I just assumed everybody else was completely comfortable in their own skin. And, I live with a woman who is extremely, intelligent and doesn't care if she drinks or not. And is really well accomplished, and I certainly look at her, and I know that we all have our inner demons and things like that, but I just assumed like everybody was just like, hey, the world's going great for me. I'm successful because everything, like, I'm just super confident. And it was really paralyzing for me just to like have to think about doing things that other people did, because I was just like, I big time imposter syndrome, I think, is the biggest thing. But.
That's interesting.
So, Grant, tell people what you do, because you're making it sound like, you sort of collect cans to get 5 cents to support your family. Tell people what you do, you highly unaccomplished human being, you.
I'm a pediatric rheumatologist, which rheumatology in general, for people who aren't familiar with it, is a subspecialty of medicine that deals with a lot of inflammatory or autoimmune conditions. Probably things that people are most familiar with just because of the name is rheumatoid arthritis and lupus. There are some diseases that attack skin. There are diseases that attack muscle and blood vessels, things like that. And I am a pediatrician. First, I did 2 years of residency in that, and then I did a specialization in peds rheumatology. So I deal with primarily 18 and younger patients that have arthritis or lupus or dermatomyositis. I do see some kids through college just because once I get established with them, it's nice to have a good transition, because that's a difficult time. And then in Fargo, I will see new patients up to age 21, just because the adult rheumatologists are so busy that they, that's a subset of, not that there's a lot of those patients, but it's helpful for them. And I see college kids anyway, and it's always actually a really fun experience for me to see someone who's like not living at home with their parents most of the time. So, so I deal with kids that have arthritis, the biggest subgroup of patients that I have. And most people are pretty surprised that exists in the world. Most people don't know anybody. It's about 1 in 10,000 children have arthritis, I think, is the statistic we use most commonly in the US and Canada, at least. And, the way I think about it is, and this is not to, be just to downplay anybody else's illness. It's just not as, it's not cancer, I guess, is how I think about it. Like kids who have cancer, like everybody, not that everybody knows about it, but certainly, people are aware what cancer is, and they know that children can get cancer. The St. Jude's commercials are on all the time. And it's obviously, most of arthritis do not have a life-threatening condition, which is fantastic. It's one of the reasons why I like the field, is because, the outcomes are really good. But it's also makes it that most people don't even know, like most kids that have arthritis don't tell their friends because they don't know how to explain it to them.
Yeah,
that's interesting.
And one of the nicest things that we do through the Arthritis Foundation is we actually have a camp during the summer when there's not COVID in Minnesota that's for kids in Minnesota, North Dakota, and South Dakota, just that have rheumatic diseases, mainly arthritis, but you can go if you have a lupus and stuff too. And once kids go, if you can convince them to go, tweens are obviously the hardest age to convince, but once they go, they want to go every year because
they're in a,
they make really good friends. Yeah.
Yeah, it's exactly like what Maz talks about with AA. It's a place where everybody's the same.
Yeah.
You have a shared experience. You can complain about, I always joke with the patients, I'm like, you complain about your rheumatologist all you want.
Yeah, but Grant,
primarily they
in
complain
North
about
Dakota, South Dakota, and Minnesota, you're primarily the rheumatologist. So they're all complaining about you.
They don't. I mean, they're pretty, I mean, the kids are, they just want to go. And it's not, I mean, there's some programming about, you know, disease and disease management and long-term, you know, self-care. But there's stuff about, you know, meditation. They do, you know, but it's primarily summer camp. There's art, there's swimming, there's, you know, there's a zip line. And we get to go as doctors too for a day or two, which is really fun.
Yeah.
And I just kind of walk around camp and like see what people are doing, because most of the time I'm not that busy there. I mean, sometimes I am, but
yeah,
it's just kind of fun to see patients in the wild because they often don't know how to like interact with me either.
Sure.
But, you know, not rigid, but just set interactions.
Well, so I think it's really powerful to hear somebody who is as accomplished as you are, talk about this extreme insecurity, because I think we all have it. I mean, your fabulous wife has it. I have it. I think to be human and not to be a narcissistic sociopath is to have insecurities. So what's always compelling to me is, what is the extra thing? And I don't expect you to have an answer to this, but for both of you, what is the extra thing that takes insecurity to an addiction?
Yeah. I mean, I can think about my journey through alcoholism, and I've thought about it a lot, obviously, since I've been sober primarily. I mean, growing up, I certainly didn't think I drank any differently from my friends. I mean, I certainly, you know, and my dad does drink. My mom can't drink. She has an enzyme deficiency that makes her sick. And so, you know, but I never really saw my dad drink in front of me. It wasn't like he would go drink with his friends, but it wasn't like he was, you know, often doing that. He was never someone who would drink at dinner. My older brother was, you know, his friends partied a lot in high school. And so I saw that. And I didn't, he's not the reason I'm an alcoholic, but I was like, oh, that's really cool. Like, I want to do that too.
Mm-hmm.
And I didn't start drinking really early. I mean, it was earlier than people should. And so if any of my patients are watching this, don't drink in high school or until you're 21. But, you know, I drank in high school. I went to college and I thought I had a pretty normal college experience. I didn't think I drank more than my friends. Again, in hindsight, I certainly did. I certainly drank to excess more than them. I didn't really have any negative consequences, really. I mean, my freshman year of college wasn't great, but I did well enough during the rest of college that, you know, I was able to go to medical school and stuff. And really, when I can pinpoint that my behavior started to become abnormal was when I was in a fellowship. And that's, you know, the second training 3 years after residency. Residency, you're so busy. Like, I mean, you do have time down, but you're not really, there's not a lot of downtime. And I can, for me, it was when I got into a situation where I had no idea what I was doing, which was being a basic scientist, and was kind of left on my own devices to figure that out. And I, for the life of me, couldn't figure it out. It was just not something I ever thought I was going to do. And I didn't take notes. I couldn't repeat experiments. I just start over every time, which, as Maz is just probably just thinking in his head, like that's the exactly wrong way to approach it.
No, it's part of the learning curve.
Yeah.
You've got,
It's a way.
it's a way.
Yeah. But I just remember like, that's what really kind of triggered my nervousness. And it wasn't the lab I worked with. I mean, my mentor in the lab, he's still one of my good friends, and he's a really good person, but he's not a great mentor for me. He's very hands off and kind of like figure it out on your own, because that's how I did it. And I needed someone to walk me through it. And I didn't feel comfortable enough to ask him for that. And his people in his lab were busy, and often made it apparently abundantly clear to me that like they didn't have time to do that for me. And so I just kind of like went to the lab, pretended to do things, would always be behind, would procrastinate. And I allowed that to really, I started to self-soothe with alcohol. And over time, that started to become an issue between my wife and I. And so I started to hide alcohol, which, should be a sign to people. If you're hiding alcohol from your partner, that's generally not healthy. And that just kind of escalated, and over time and more time, and just eventually got to a point where my life was unmanageable. And through a series of events that occurred to me, I had to get sober. And I was told I had to get sober, and that was a relief to me, because I didn't know how to do that on my own. And I tried quitting. I mean, I quit for darn near 9 months when my son was, my wife, my son, my first kid. And so I was like, oh, and then it's fine for me to drink again, right? And then that didn't work. I would try what I drank, how I drank it, just trying to be super controlling. And knowing full well, I mean, I knew I was an alcoholic. I mean, I recognized that my drinking patterns were extremely abnormal, and not like other people. But I would hide it to the point where I wouldn't drink in public. I would make a point of not drinking. I know, Maz, we talked about this, of going to like parties and going out of my way to like, no, I'm just going to have some water, whatever. And like, of course, drink before the party, drink after the party. I know. And I was a very solitary drinker. It made me very uncomfortable to drink around other people, primarily because I was like, I need to drink more than this. And I need to drink it faster, and no one's drinking fast enough. And, and I went to therapy. I was never honest with my therapists. I waited for somebody to tell me, I think you're an alcoholic. And I would ask them straight up, even though I was lying to them. I'm like, do you think I'm an alcoholic? Well, they're like, well, we think you abuse alcohol. I was like, well, then I'm not an alcoholic.
Yeah.
And then finally, a psychiatrist, I didn't realize that at the time that, in the DSM or the psychiatric manual, like alcohol abuse is on a spectrum of alcoholism.
Oh,
because I wasn't a psychiatrist. I didn't look it up. I wasn't trying to find proof. But finally, I saw the psychiatrist right before I moved from Madison to Fargo. He's like, you're an alcoholic, right? And I'm like, yeah, I do. He's like, you need to start to go to like AA meetings and stuff. And I was like, no way in hell. Like, people will know I'm a doctor from the moment I walk in the room, right? Nobody knows. And there was even a physician meeting in Madison, which I'm sure is well attended. Wisconsin is a very heavily drinking state. And there are plenty of, physician substance abuse is higher than the general population. We don't talk about it, but just like physician suicide is generally higher than the general population. There's a lot of mental health and stress that goes along with it. And we're all, for the most part, very ashamed to talk about it with anybody. There was a surgeon in Detroit Lakes who I knew, just graduated residency, and I didn't know. I don't know if he had substance abuse issues or not, but he ended up killing himself this summer, and I was just like, I had no idea.
Yeah.
Nobody had any idea, and like, he had just gotten his dream job. He had a wife and 3 kids. And, it's just one of those things that no one thinks to ask. And I didn't ask him. I mean, I wasn't that close of friends with him. I just had been an acquaintance, but still, like, it's something that you would think when you go to your doctor. I mean, they kind of breeze through it when you're a physician. Like, I would go to my doctor in Madison and, like, obviously have liver abnormalities on my labs, and I'd tell them how terrible I felt all the time. Like, I'm so fatigued. Like, they're like, oh, maybe your thyroid's messed up. I was like, okay, maybe that is. But, like, nobody said, like, really pushed it, because people just trust you to know your own health.
Yeah.
And also, I think it's uncomfortable for physicians to ask each other. Like, I don't mind asking people now, but that's taken me a really, really long time. And I've not, to this point, had someone who I thought probably needed help, had them get help from me.
Yeah.
I've asked them, like, hey, do you want to go to a meeting? Do you want to do this? And, that's, right now, obviously, is not a great time to find people in sobriety, because there's no meetings in person and things like that. But, yeah, I mean, and it's not, in hindsight, again, it's not surprising that no one told me I was an alcoholic, because I wasn't honest. And, it really took a series of, unfortunate events, as the children's book talks about, to get me to that point. And I had to have someone tell me, if you essentially don't get sober, you're going to lose everything. And I didn't get sober for my kids. I didn't get sober for my wife. I didn't get sober for my parents. My parents had no idea, because I lived in Wisconsin for 12 years and I lied to them all the time. And my wife's parents had no idea, even though she called them and told them, Grant's drinking too much. I don't know what to do. And, I would lie to them and, essentially gaslight, I think that's the term, everyone, and especially Melissa. And, it was all a shock to them when I was like, yeah, I have to go to rehab. And they're like, what? What's going on? And my brothers are all like, what? What's going on? I have 4 brothers. Like, none of them knew. And they're like, do you really think you're an alcoholic? And I was like, yeah, oh yeah, I'm an alcoholic. I need to get help. So,
Yeah.
And I was really lucky that there's a physician's professional program in North Dakota called the NDPHP, which you can voluntarily join. And it's, completely, the Board of Medicine doesn't know if you join. And
Wow.
so it's very nice. They used to be with the Board of Medicine, but now they're separate entities for that reason. And you don't get reported to the Board of Medicine unless you, like, fail. And I certainly, the person at the time who was running, his name was the physician running manager. His name is Barry March.
Yeah.
And Barry's an awesome guy, and, like, I needed someone who would call me on my bullshit.
Yep.
And he was just like, you're gonna, he's like, we're really worried about you. You can't do this. And, like, and when I got in trouble and I called him and I was like, hey, Barry, I think I need to join the ND. He's like, yeah, I know. Like, and he didn't force me to do it. I mean, I volunteered. Now, the Board of Medicine did force me to do it, and I was already in it when they did. But it certainly is something that I've felt has been really, really, integral to my sobriety too, because, you're in it for 5 years. There's actually good statistical data that if you do a physician's health program like that, your likelihood of success is, like 75%.
Wow.
Which, compared to the general population of like 10% or lower,
That's amazing.
it's in a really good program. And, there are lawyers organizations that do something similar. And we talk about this, we have a professionals health professionals meeting Tuesday night at 7:30. If anybody wants to know about it, contact me and I'll give you the information. We're always looking for new people. But we talk about just the differences between the Board of Medicine versus the nursing board. The nursing board has a monitoring program too, but they're much more not, harder to work with, but it's harder than the NDPHP for sure. Like, they have a much harder time um, uh, and nurses in general have a harder time getting back into the workforce and things like that. I mean, again, as a physician, like even if you have an addiction, if you can show you're in recovery and have a sustained period of recovery, you're probably going to be able to continue to practice. Maybe not where you want to or what you want to do, but there are always things out there for people that have an MD behind their name, if that's what you want to do. And I'm really glad that I'm in the NDA PHP. Even after my initial 5 years is up, you can stay in the NDA PHP. I worry, my primary worry is that after 5 years, and if I don't want to do it, like, oh, will I feel like suddenly, will I suddenly crave alcohol?
Yeah.
I don't have cravings. I feel really lucky. I really haven't had cravings at all since very early in my sobriety, and that's made my life very it has made my life much easier from that standpoint.
Yeah, I know the feeling.
Yeah. But at the same time, I still meet with my sponsor. I'm having lunch with him today. I try to go to meetings when I can. Right now it's a lot of Zoom, which is definitely not as good as in person.
No, I mean, I'm glad that
I'm trying to get sober right now.
Yeah, it would be really rough, wouldn't it?
Yeah. Yeah.
Well, I so appreciate your willingness to join this funny little conversation that we do every day and to be so honest. I think the only way we will actually make any headway with addiction is when we stop treating it like it's something to be ashamed of. I mean, if we did daily dose around cancer recovery, every day people would say, good for you, it's so amazing, you survived.
Yeah.
Until we can do that with addiction, people are going to lose to it because the fear of being honest so far outweighs the hope of getting sober that it's just incredible. And I can say, as somebody who until I lived it was super judgy of it, and would have been highly judgy of people who are very educated, because I would have thought, well, you should know better. There are some kinds of people who become addicts and it shouldn't be you two.
Right.
Well, there are some kinds of people who get cancer, and that's called everyone.
Yeah.
So until we accept that, I mean, it's the same concept as mental health and all the things that you can't see.
Right.
So I just so appreciate you coming on and sharing your story. And I so appreciate our new friendship.
Yes.
Because you two are in so many ways like a younger version of us. You've been married the same amount of time. You've been sober the same amount of time. You have this bonkers, the four of us have a lot of education between us. And that none of that has kept the two of you from falling into it, and none of it saved Melissa and me from finding spouses who we invested in and stayed with through this journey. So thank you, Grant.
Thank you, Grant. That was great.
Oh, you're welcome. Thank you for having me. I mean, when I first got sober, I really wanted people to ask me, like, are you sober? Like, do you not drink? And I wanted to be like, yeah, I'm in recovery. I was really excited. Now I'm like, I'm not, like you said, I don't hide it.
Yeah.
And I mean, I don't really have conversations with my patients about it. I mean, I think sometimes I wish I was able to do that, because I know, hearing from some of my colleagues, they work in the ER, they work on the internal medicine floor, and they tell me like how gratifying it is for them to be like, someone came in with alcoholism and I talked to them about my story, and that's like very AA, right? You want to like share with people and help them get healthy. And, thankfully it doesn't come up. And I mean, I do ask teenagers about drinking, and I tell them, like, you need to be smart about it, and you need to make sure that you understand that your brain is still developing. And but obviously I'm not bringing it up to a 2-year-old. They just be looking at me funny. But sometimes I'll see parents that I see in meetings, and they'll be like, oh yeah, because I mean, they don't. Some of them know I'm a physician, some of them don't.
Yeah.
And then sometimes I'll see them with like their spouse, and they're like, "How do you guys know each other?" Like they're just like, we're like, "Oh, you know," I don't tell them, right? I'm like,
Right.
like I'm assuming they know they're in AA, but I'm not gonna be like, "Oh,"
Right.
and so it's always a funny interaction. But
Yeah.
um, no, it's definitely something that I think society is much better about it than they were 10 years ago.
Yeah.
Yeah.
And I know that in the state of North Dakota, they are trying to be more open about it with the governor's wife.
Hmm.
Um, and I think that's been helpful. I certainly don't think there's as much of a stigma. Like I certainly haven't felt from the people I've told, it's ranged from no one has been like judgy about it
Yeah.
to my face. I mean, thankfully, maybe they have been, but most people are like, "That's great," and then they just move on.
Yeah.
Yeah.
And then, like one of my friends, I remember telling him because we've known each other since high school. I was like, "Tom, I'm in recovery now." He's like, "All right," and just like went into the next thing. I was like, "Don't you have any questions?" That's what I was like.
Yeah.
But that's me being egotistical. So it's okay.
Have a PowerPoint. Yeah. Well, we will let you back to your day, but
Thank you,
thanks
Grant.
again for
Yeah.
sharing with us and for just being an additional incredible story of accomplishment and struggle and success and insecurity and all the things that are what make us all who we are every day. And the only place to live is in the truest place you can. So thank you for that.
And I wanted to show you guys my mug
Oh,
from the Milwaukee Art Museum. It's a Chuck Close they have there.
Oh yeah.
oh, nice.
I gotta say that's one of my all-time most favorite museums I have
Yeah.
ever
You
been
live
to.
across like the big high. There's like a big street in Milwaukee. We lived across the park from the art museum when we lived there, and that
That-
was like one of my favorite memories is when my son Isaac was born. We still lived there, and I took paternity leave at the end of my fellowship because I could, and I
uh-huh.
knew I wouldn't be able to when I wasn't attending. And um, I remember just me and him. We would walk over there, and I'd push him around in a stroller. And that's like, I love that museum too. And I it's one of the biggest things I miss from Milwaukee. But
Yeah, it's a very cool art town.
yeah.
Public art, the murals, all of that. So thanks, Grant.
Thanks,
Have
Grant.
a great day.
Have a great day.
We'll see you soon.
See you
Bye-bye.
soon.
Bye, everybody. We'll see you tomorrow.
Bye.